Dozens of Australia's top lawyers are so disturbed by the number of police welfare checks that end in loss of life that they've signed an open letter to the New South Wales government. They want trained mental health experts to be called in as first responders to crises, not police. One of the signatories is the CEO and founder of the National Justice Project, George Newhouse, and joins us in the studio. George, thank you for joining us. Now, police are called by family members and carers who want help.
Yes.
Are police trained to help?
Tragically not. I think over the years you've seen a failure to invest in health services and welfare services, and so we send police as carers of last resort, and they're just not equipped for it. For example, they do 18 hours of mental health training at Police Academy in New South Wales, and then they don't get any other training, but they get lots of regular training on how to use weapons, and they use them. And I think there's a real problem with sending police in as first responders. We need to change the whole approach and send a medical or welfare team in these critical situations. And
this isn't an issue specific to New South Wales, it's nationwide. And you talk of weapons, there have been lots of incidents where police have arrived with a weapon already drawn.
Yes.
Have you got any stats to show when the loss of life is occurring, after what period of time after officers arrive?
Well, tragically, I know of a number of cases where people have died within seconds, within less than 10 seconds of police arriving. There's a case in Western Australia, and certainly in New South Wales recently, I've been told, where police used their weapons within seconds of arriving at the scene. Now, that is not de-escalation, and you would never get that response from a social welfare team. And that's why I don't think it's a question of retraining. I think it's ensuring that police aren't first responders.
Police will say that on those occasions when they've arrived, the person has been holding a weapon of some kind, scissors or a screwdriver or a knife.
Yes.
Does that, what do you say to that?
Well, in many cases, they're no threat to anyone, including the police. We've had situations where individuals have been armed, yes, but with a knife in their own homes. They weren't presenting a threat to anyone, and the situation could have been dealt with very differently. Obviously, there are risks where there's a weapon involved, but surely you've not made any effort to de-escalate where you arrive on the scene and then you shoot someone within seconds.
And the people who have been shot and the victims of this are at the intersections of a disability or a First Nations person.
Yes.
And today, specifically, is the 40th anniversary of the violent death of John Pat in the Pilbara.
Yes.
It's been, since the Royal Commission into Aboriginal deaths in custody was handed down, the findings,
yes.
There have been over 500 deaths in custody. Should these rules also apply to custodial officers?
Absolutely. If you look at the case of David Dungay Jr., for example, you see the intersection of mental health care and police, the use of violence by corrective services officers or police. These, I believe very strongly, that if people with weapons are not sent into crises and mental health crises, people would be alive today. Some of those 500 people would be alive today.
Mm. And your recommendation is for training for mental health experts to go in rather than police?
Absolutely. It's not just training, it's funding. We need to fund and empower a health response to these crises, and that would help. We're also calling for an inquiry. I think there needs to be an inquiry into alternatives to the police. There may be better solutions, but I can tell you this, if it wasn't a police or corrective service response, people would be alive today.
George Newhouse from the National Justice Project, thanks for joining us on Midday.
Thank you.